Hi and welcome to another video update from the Fire Brigade Union, a socially distanced video update here at the Union's headquarters in Kingston, London. We're joined by National Officer Riccardo Latore to discuss a vital defence that the Union has put forward regarding breathing apparatus safety procedures. Now Riccardo, I talk about defending the safety procedures. This is in light of proposals put forward by London Fire Brigade to change a decades-long safety procedure. What was the proposal and what was the Union's response to it?
FBU officials locally have been in consultation with the LFB for some time now over revisions to what they call PN 633. But what that is the London Fire Brigade high-rise firefighting policy, a policy that will be in place in every FRS across the country. Now there are many revisions to that which we found agreeable, but there are particular elements, and one in particular around BA and how firefighters use their breathing apparatus set that simply wasn't acceptable to us. The LFB were proposing that when we go to a high-rise fire, in some circumstances, firefighters are to be deployed beyond what we call a bridgehead into the fire without wearing their breathing apparatus properly. They'll have it on their back, but they won't have their masks on and they won't be under air. And we need to be clear here, breathing apparatus protects nobody if it's simply on your back and not being used properly. And the reasons they gave for that is because they wanted firefighters to get as far as they could into that fire until the point that they had to go under air to protect themselves. It was unsafe, it's unlawful, operationally it's flawed, and that's why we simply had to challenge that element of the policy.
Now Riccardo, sitting here as over 20 years in the fire service, I mean straight away the alarm bells are going in regard to this. Give us a couple of examples, just for people out there who might not be familiar with breathing apparatus procedures, about why this proposal is really unsafe.
Firstly, and put simply, it's unlawful, Tam. You know, the FBU successfully argued that this policy is in breach of health and safety law, and will be providing further detail on that to members and officials in the coming days. But fundamentally, you are absolutely correct. It is unsafe. It's extremely unsafe. Breathing apparatus keeps firefighters alive. It has kept firefighters alive for decades. We cannot remove that control measure from firefighters. The idea that you can guess when the atmosphere is unsafe is illogical. The fact that you control how quickly that atmosphere becomes safe is illogical, and we know that from previous incidents where we have lost firefighters and firefighters have been injured. It completely eliminates a firefighter's ability to do safety critical pre-entry tests which ensure that that BA set is working, as every firefighter will know. And by its very explicit intentions to place firefighters further into the building beyond the reach of a BA set, what that means is we cannot rescue firefighters who are in distress. If a firefighter is in distress, which even the LFB acknowledged in this instance, is a higher risk given this proposed practice. If they are beyond the reach of a BA set, they are beyond the reach of a BA emergency team. Therefore, they are beyond the reach of rescue. It's simply unacceptable, Tam, and something that we had to change.
Now this isn't just about firefighter safety, Riccardo, is it? It's also about public safety. Tell us why.
The problem we're faced with here is the problem of unsafe buildings. That's the problem the LFB are trying to resolve with these proposed revisions. But removing the safety from firefighters doesn't make those buildings any safer. Moving the safety from firefighters doesn't make the residents any safer. And we identified within our arguments, within our submission, an extremely increased risk to firefighters by this practice. The LFB themselves acknowledged that risk, and the panel agreed. So the simple fact is, dead or injured firefighters cannot rescue anybody, and in fact it undermines our rescue efforts by redirecting resources on the operation ground.
Absolutely. Okay, so the London Fire Brigade put forward these proposals. The Fire Brigade Union believed the endangered firefighters. There was a third party then involved, and it's called the Health and Safety Advisory Panel. Effectively, they heard the case on each side. What was that process? What did that process look like, and what was the outcome, Riccardo?
The Health and Safety Advisory Panel is a panel quite unique to the London Fire Brigade, and we welcome the LFB agreeing to take this matter to the panel, which in effect is a professional exchange of ideas over the policy they wanted to propose and our objections to it. But what's significant about this panel is it's overseen by an independent chair. In this case, a chair called Andrew Strawson, who's an ex-HSE inspector with a long respected experience of fire and rescue service matters. So we deliberated on the day, we considered the LFB's arguments and submission and the FBU's arguments and submission, and the outcome was, the recommendations of that independent chair was that the LFB had to remove that element, that dangerous practice, from the policy.
Okay, so the chair effectively agreed with the Fire Brigade Union, believed these proposals were unsafe. Is that it? Is it over with? Or is another stage to go through?
No, we presented on the day the arguments I've just set out with you around law and safety. We've just had significant research published as well on the carcinogenic and toxic effects of fire effluents on firefighters. So even if it didn't harm firefighters immediately on the day, it's very likely that exposure will harm firefighters in the future. And we put forward all the operational arguments, and as we say, the independent chair took them arguments on and has advised that the policy, or that element of the policy, is removed. The problem now is that this issue goes beyond just the LFB. The panel was for the LFB policy, but national guidance exists, national guidance published by the National Fire Chiefs Council, which permits this same dangerous practice. So we are now calling on the National Fire Chiefs Council as a result of this panel, where the practice has been forensically analysed and the recommendations are that it is unsafe and we believe unlawful, that the NFCC now need to immediately retract and remove that guidance.
Okay, that's a message to the National Fire Chiefs Council. FBU members from across the country will be watching this, professional firefighters. What's your message to them? How can they get involved in this issue?
My message to members would be, we had no choice but to challenge this unsafe practice. No other organisation within the Fire and Rescue Service did, only the Fire Brigade Union. And as I say, in fact, the NFCC produced national guidance permitting it. We now have to ensure that this policy isn't introduced in any fire and rescue service in any way. So we'll be holding meetings, we'll be producing documents and guidance for local officials so that we can challenge this legally, industrially, any way that we have to, where it raises its head, because we cannot compromise when it comes to the safety of firefighters, and also, as we proved with this, the safety of residents and the public. So I advise people to read the circulars, go to their branch meetings. We will be raising this at health and safety joint committees, and we'll challenge it wherever it comes up.
Ricardo Latore, thanks very much.
Thank you.